As many wildfire evacuees start returning home, new research is shedding a troubling light on the impact wildfires and the smoke from them have on our mental health. A new study examined the relationship between wildfires and mental health-related hospitalizations in Canada, and the findings may surprise you. Joining me now to discuss it is Soodeh Saberian, an associate professor of environmental economics at the U of M and one of the study's authors. So good to speak with you tonight.
Thanks for having me. It's a pleasure.
First, maybe give us an idea of what you learned in this study. Just how do wildfires impact our mental health?
This is one of a kind of studies that considered four different channels to study the effect of wildfire, as opposed to previous studies that look at only smoke from wildfires. As climate change is going to intensify the frequency and also intensity of natural disaster, including wildfire, it is very important to recognize the channels in addition to the magnitude of the channels. In this study, my co-author and we considered the direct effect of wildfires, including evacuations, and also maybe you are not evacuated, but you are close enough that your business is affected or your amenities affected, and that's why your mental health is destroyed. We also consider and quantify the effect of smoke from wildfire on mental health, and eventually we introduced a new channel that was recognized in psychological paper, but nothing economically, that is called climate anxiety. Maybe you are far away from where the fire is affected, but because you care about climate or because you have a child that has cardiovascular condition at home, that makes your mental health bad. So we included all these channels, and we quantified these effects on mental health related hospitalization in Canada.
I want to talk a little bit about the last point you brought up, because I thought it was interesting. It's not just those in the wildfire zones that are impacted by this. Just how far-reaching are these events, and are certain segments of the population more at risk?
That's a really great question. I want to emphasize that wildfire is very different natural disaster compared to other natural disasters that are going to be a new normal in our era, because the effects are maybe a wildfire. The last wildfire in LA, the smoke went all the way to Japan. So it doesn't matter where you sit down, no matter what, you're affected. In addition, like the climate anxiety channel, there was a Time article in 2023 that for the first time put a number on climate anxiety, and they show that the Google search for climate anxiety in 2023 was 4,000 times more than the year before. And that's why we thought let's say you are in Halifax, but you have a child that has asthma, and the smoke didn't reach you because of the wind direction, but you care about fires like forest in BC, and that may affect your mental health. So what we did, we looked at the relation between Twitter activities that include #wildfire in Canada, and because we wanted to only capture climate anxiety that are not because of your proximity to fire, but the fact that you are living far away from the fire, but still because of the fire activity you get the anxiety. We excluded only tweets that are 500 kilometers away from where fire is happening. And then we correlate that with number of mental health hospitalization. And it was surprising because the effect is as large as what we see in smoke-related effect.
Very interesting data. Soodeh, I want to thank you so much for sharing your work with us tonight. It was great speaking with you.
It was my pleasure, and I just want to emphasize that mental health and fire are going to be two very important issues of our few next years, and it's great that we shed light on the research through the media.
Thanks again.